rich in fiber can actually help you live longer. New studies found a link between fiber consumption and the reduction risk of death. Not kidding, especially in men, but apparently this guy's doing well in terms of his health. The source of fiber appears to be crucial. Eating fiber whole grains was strongly linked to lowering the risk of dying from a heart attack or heart disease, while fiber from veggies and beans appeared to have a minimal impact. Now, the fiber in fruits seem to have no offering of any protection at all. Now, speaking of heart health and speaking of heart disease, it's something we certainly need to be aware of. And the younger you get started with it, certainly the better. But as we get into the older years, we certainly need to be more aware of it, taking care of our heart. So with more on that this morning is Dr. Alicia Barhay. She's in from Johns Hopkins this morning. And this is something you want to tackle it early in life so it doesn't become a problem later in life.
Right. Heart disease is really the #1 killer for all of us, so it's important to think about this. But what's interesting about heart disease is what we normally think about as protecting your heart actually changes as you get older. So what we know is that stopping smoking, eating right, exercising, all those, and keeping your blood pressure under control, all that is very important to prevent heart attacks and strokes and kidney problems. But as you get older, now I'm talking about the people over 75, the people over 85, 90, sometimes you have to be a little more careful about all those things that you do to try to keep your heart under control. For example, if I could just say, as people get older, you need a little bit of a higher blood pressure to push blood up into the brain. So you don't want to keep your blood pressure too low when you're older.
Now that's unique.
It is interesting as people get older, you want your blood pressure to be just slightly higher than it maybe was when you were younger, and your heart rate to be just slightly higher. Now, we're not talking crazy stuff like high blood pressures, 160s, 170s. We're not talking about that. We're talking about maybe just a little bit of a slight adjustment in your medication so that you have a little bit more blood going to your brain as you get older.
Now, we'll talk about something. You talk about high blood pressure itself. That's known as the silent killer.
Right.
Something that people don't even know about. So as we start getting screened for this young and earlier age, we start getting our heart checkups in earlier age. Men 35, women no later than 50. What are some things we need to look for at an early age so it doesn't become a problem when we get into our 60s and 70s?
Right. So the most important things to think about are your family history. What's already going on in your family? Is there a history of heart disease when your family was around your age? That's an important thing to think about. And it's really the simple things. Again, like I was talking about, avoiding cigarette smoking. That's the #1 thing you can do to try to prevent heart disease later, as well as maintaining your ideal weight. In terms of what to look for, besides looking in terms of your own family,
Hello, I chose to do my project on heart disease in elders. The aging of the population worldwide will result in an increasing number of elderly patients, among whom heart disease is a leading cause of death. Changes and differences in the effects of common cardiac problems, as well as the response to their treatments. Differences in the effects of common cardiac problems as well as their responses to their treatments. Patient-centered goals of care such as maintenance of independence and reduction of symptoms may be preferred over increased longevity. New, less invasive treatments are likely to improve outcomes in elderly patients who previously have been considered a prohibitive risk for traditional procedures. Clinical trials enrolling elderly patients are limited, and recommendations for management from younger patients frequently lack evidence-based support in patients aged 75 years and older. Some of heart disease's major symptoms are plaque buildup that thickens and stiffens artery walls, which can inhibit blood flow through major arteries to your organs and tissues. Some other symptoms are chest pain, shortness of breath, pain, numbness, weakness, or coldness in your legs or arms if the blood vessels in those parts of your body are narrowed. Pain in the neck, jaw, throat, upper abdomen, or back. You might not be diagnosed with cardiovascular disease until you have a heart attack, angina, stroke, or heart failure. It's important to watch for cardiovascular symptoms and discuss concerns with your doctor. Cardiovascular disease can sometimes be found early with regular exams. Diseases under the heart disease umbrella include blood vessel diseases such as coronary artery disease, heart rhythm problems, and heart defects you're both born with. Chest pain, shortness of breath, pain, numbness, weakness, or coldness named above are all various symptoms of heart disease. Treatments for heart disease range from low-tech to high-tech. Read about them here. You'll also find advice for caregivers, including tips for caregivers would be CPR, a stent, angioplasty, and heart bypass surgery. CPR stands for cardiopulmonary resuscitation. It is an emergency life-saving procedure that is done when someone's breathing or heartbeat has stopped. This may happen after an electric shock, heart attack, or drowning. CPR combines rescue breathing and chest compressions. A stent is a tubular support placed temporarily inside a blood vessel, canal, or duct to aid healing or relieve an obstruction. Angioplasty is the surgical repair of unblocking of a blood vessel, especially a coronary artery. During heart bypass surgery, a blood vessel is removed or redirected from one's area of the body and placed around the area or areas of narrowing in order to bypass the blockage and restore blood flow to the heart muscle. The vessel is then called a graft. Gender or racial differences. Heart disease remains the leading killer of adults over age 65. We're accounting for 400,888, 156,000 deaths in 2013. The most recent statistics are there were a near doubling of the rate of awareness of heart disease as the leading cause of death in women between 1997, when the AHA launched its first campaign for women, and in 2009. During that same period, the death rate resulting from CVD decreased by nearly half. Risk factors for such habits are high blood pressure, high blood cholesterol, diabetes, smoking, obesity, physically inactive, having family history or early heart disease, having a history of preeclampsia during pregnancy, unhealthy diet, and ages 55 and older for women. Some preventative measures that can be taken would be no smoking or tobacco, exercise for at least 30 minutes a day, eat a heart-healthy diet. Some major sources of saturated fat include red meat, dairy products, coconut and palm oil. Some sources of trans fat include deep-fried fast foods, bakery products, packaged snack foods, margarines, and crackers. Always maintain a healthy weight, get enough quality sleep, and get regular health screenings.